Hi, this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart. It's Wednesday, and I'm going to talk about pregnancy, but not pregnancy in the sense that we usually think about it, but it's about pregnant silence and pregnant questions. Um, Pregnant silence has been around for a long time, that descriptive term when meaning silence is loaded, and it comes up in therapy sometimes um, when somebody is very silent, and then there's the question of how do you work with somebody who's very silent, and that's a case-by-case decision. You can't make a generalization, but it certainly is significant for different people, and sometimes at different times. So the silent person could be silent because of being afraid of saying something, because of the consequences they might feel it would have on me. Like maybe they have said some things in their past, and they were reprimanded or thrown out of the house. Some people don't say things because they feel very ashamed of what they have to say, so that's the resistance. The shame is the resistance to saying something, and that needs to be respected. And so with silence, you leave it and see where that person's going to go. I could ask, a therapist could say something about, ask a question like, is it a comfortable silence or not? And see how the person responds. If it's a new person, you have to be very careful and gentle, because you don't know how they're going to respond to a question. A question could feel like a criticism, and so the best thing to do, in my opinion, is to wait. But if the person becomes very uncomfortable or seems that they're comfortable, if they said yes, I could ask them, no, is there something I could do to make it more comfortable for you here? It's hard to bring attention to something, about something that's happening, because people are very sensitive to so many things. And since, especially with a new person, if I don't know that person that well, I would want to get to know that person before I say much of anything. So silences are pregnant. It could be full of meaning. For the resistance is a shame about how they feel about what they have to say, and or that I'm going to throw them out of the office for whatever they say, or not talk to them, or feel uncomfortable that they said they said something wrong. Yeah, so silence is very difficult. Dr. Marie Lucas talked about a case where she was a person that she worked with for 2 or 3 years, and that person hid behind the couch. And hid is not the right word, because I'm not sure what her motive was for doing it, but she stayed behind the couch. Whether she was hiding or not is a matter of interpretation, but she stayed behind the couch for two years at least. And Marie tolerated that, and she was an amazing analyst, because how many analysts would be able to consider tolerating that, or maybe tolerate that for a while, but 2 years? But she did. And most therapists would have had a countertransference reaction to that. It's like, they begin to feel inadequate because they can't help the patient talk. That's the first line of reaction, is the feeling of inadequacy. I'm not doing anything. What am I doing? I'm not helping the person. There's no conversation, or there's no talking back and forth. There's no dialogue. But D.W. Winnicott did write an article about the capacity to be alone in the presence of the other, and usually he was writing about children and the mother. So there's a certain capacity that develops between infant and mother to be alone in the presence of the mother. Now, my guess would be that maybe this person had a very intrusive caregiver. Didn't have to be the mother, it could be a father, but caregiver who is in charge of their development and to be with them. And if they're very intrusive, that's not a good way to be with a child growing up. Not at all. Intrusiveness doesn't help and makes one feel vulnerable and can't hide. Talk about hiding. They can't hide their own thoughts because they're afraid that they're going to be pushed to reveal things, and they don't have a sense of their own self ability to be able to be different and differentiated from the person who's being intruded. So it was but that was an amazing case. So there's pregnant silence and there's pregnant questions. And I've been talking sometimes about, my technical director, David, came up with the pregnant silence, which is really a great term. I haven't heard it. I mean, the pregnant question, because it made me think, because about how things that I've thought about but didn't put a name to them like that, a pregnant question. So questions we often have addressed to ourselves as therapists. And I'm a modern psychoanalyst. So in modern psychoanalysis, what we try to do is follow what we call the contact function, and that means that when the person is contacting me about something about myself, you investigate it. Investigating could feel hurtful to somebody if you don't answer the question. Sometimes. As a matter of fact, I wrote a paper around the experience I had when I asked my teacher, is there any occasion where you might answer a question about marital status? And she said, reprimanded me. So I'm not going to go into that whole long story. I'll probably put it in my book. But so I wrote a paper about how needs of the person have to be gratified in therapy. Certain needs have to be gratified. And that's very important, or else the therapy is not going to proceed very well. But what needs? So sometimes a need to have a question answered will be a necessary one. And how do you know that? Well, if I investigate a question and the person feels very bothered by it, I can still investigate it. But if they're going to feel hurt and leave treatment because of it, then that's not going to help. They're not going to be in the treatment either. So how's that going to? But for most of the part, generally, in my beginning years of training and experience in therapy, I was afraid not to answer a question because of the patient's reaction to that, my not answering. But I didn't know how to not answer a question at that time either. So then, there's a way that I discovered that you can not answer a question, but be sensitive to the person at the same time. So I found a way to be interested in the question, and not just not answer it, but I would be interested in it, so I'd examine it, which is what's mostly what we want to do in analysis. It's not like a general conversation that we're having that we could have with anybody, and on the street or in a restaurant or home. It's different. So you want to understand things. And when I understood that when a person brings a question, they're really bringing a problem with them encased in that question, that it shone a whole different light on questions. Like the video, which I've mentioned many times, the patient asked me if I lived where I worked. See, if I just answered that, he never would have come to the understanding that he was asking because he wanted to feel special. If I just said I lived here or I didn't live, it wouldn't have answered it, and that opportunity would have been gone. I wouldn't say it would come around again. I could have answered the question and then asked him what the significance was, but I don't think I would have gotten there that way. His need, a partial need would have been satisfied, but not his really deep need at some level to want to express how he wanted to be special and how he never was special. So it's like somebody asked me the other day when in the waiting room, I think it was when she came into the office, she said, have you worked with many people who are depressed? So I said, That's a good question. What makes you ask? So it turns out that she really wanted to know if I would be competent to see her. And she's never going to, if I said yes or no, that's not going to help her feel confident in my abilities. What's going to help her feel confident in me is being able to have an experience with me for a while. And yeah, so once we got to that, and then we talked about how incompetent people have been in her life that had care over her, it made sense, right? She wanted to, but am I just saying, yes, I have, or no, I haven't, whatever it would have been, you know, I could have said, no, I haven't, but what if you were the first person that I've seen that was depressed? I could play with that a little bit if I had a person who I could play with, you know, what if I was the person? And, oh, well, you wouldn't have any experience. Well, haven't you, I could ask, well, haven't you known experienced professionals who've really turned out pretty bad? We see it in the paper all the time, right? Abusing patients, yeah. So I like to investigate because there is, pregnant question means to me that there's an underlying reason why the person is bringing that question to me. It's not just a cigar is a cigar, which sometimes it is, a cigar is a cigar, but I'm a psychoanalyst, so I want to go and see if there's something else there, and I will answer a question. I don't have any, I can answer or not answer. I have the capacity to do both now. So, but it's fascinating what people will come up with. Someone asked in the group, by the way, the training group that I was announcing it started, so it's going along well. But that came up in the training group. Somebody a member asked me a question, so I asked her about the question, and it was interesting what came up about it, you know. And I think she learned something too, because I am modeling for her what to do in therapy. So she's a new practitioner, fairly new, not new, but fairly new. So I asked her, and we role played, and she really gave me a hard time as she could, because I wouldn't answer the question. That was fine, and I handled it, and I didn't get annoyed, and I investigated it, and I think she got a lot out of it too. Yeah, so why don't you want to answer my questions? Your questions. You therapists have all your tricks. Oh, is that you have? I see you have an objection to my having tricks. What's your profession? Do you have any tricks in your profession? What is it? How is it for you if I don't answer? What's important to you about you getting an answer? What is important to you? So you can get there. If you go along that line, you'll find out the meaning of something with the person. So many of you probably are thinking right now, maybe he's using his tricks. As therapists always do that. They answer a question with a question. Well, that's true. And we're doing it for a reason, not just to bust your chops. Yeah. No. And people often don't have the capacity to not answer a question. I don't know how many times people have been experienced being in a party or on a date, or somebody starts asking them a slew of questions like, have you ever been in a relationship that lasted? Are you married? Are you single? What are they trying to get at? If you say you're married, are they going to know anything about you? If you're not married, are they going to know anything about you? No. They're trying to box you in, or me in, instead of saying, gee, I want to ask you a question about whether you're married, but I know that probably is not going to soothe me, because underneath it I'm anxious about whether you will be a desirable man or woman to go out with. That's direct, right? People don't want to be direct. It's hard to be. Not that they don't want to be. You're more vulnerable if you're direct and ask what's on your mind. If you just ask a question, yeah, you think you're going to get somewhere, but most likely you're not. I mean, you can have been married and been a rotten son of a bitch. You can not marry and be a rotten son of a bitch, right? One has nothing to do with the other. Maybe you were married 3 times. Does that necessarily mean that you have less of a capacity than someone else who's never been married? No, it doesn't. So, pregnant questions, yeah, they're loaded. But again, to repeat, when they are brought into therapy, we follow what's called the contact function, meaning the person is contacting me, and that's where we would be active. Not that we wouldn't be active in other ways, but yeah. Yeah, so that's modern. It's one of the basis of modern psychoanalysis is not interpreting, because it's going to make a person feel small, sometimes criticized. We don't ask feeling questions generally in the beginning because people often don't know what they're feeling, and also often questions like, what do you think about that? Well, if it's okay, if somebody has the capacity to respond to that question, but what if they feel put on the spot? What do you think about that? You know, people's egos functions are interfered with because of the way they're raised, particularly if they've been criticized and shamed a lot. Their ego function, executive function of the ego to think, is often interfered with. So they often will feel put on the spot about the why questions. Not that I don't ask them sometimes, but generally I try to stay away from them. So, pregnant questions. My producer David, I think, coined that for the podcast. We did one podcast first before the YouTube videos. Podcast 30, I think. Yeah, this is YouTube Talk 70. And that was podcast 30. You can find the podcast, by the way, if you go to soundcloud.com and put in Therapy for the Heart. And it's a companion. It's the audio to the video of YouTube. And often the content is similar. So you have both opportunities to listen and to watch. So I'm going to sign off right now for the YouTube channel Therapy for the Heart. It's Dr. Mark Sehl. While you're watching, I hope you can press a button and whether you like this talk or not, and hope to see you again. This would have been around Tuesday, but it's Wednesday, so hello on Wednesday. All right, so I'm signing off right now, and have a good day. Bye.